Hi, my name is Christy Anderson, Regional Account Manager, and today we're going to talk about Pentech's nursing program. Pentech Health employs over 170 registered nurses across the country who provide intrathecal pump management services to over 6,000 patients. Since 2013, Pentech Health achieved the only ANCC accredited intrathecal nurse training program worldwide. In 2019, ANCC awarded Pentech Nursing with distinction as an intrathecal nurse fellowship. In short, this means our nurses' expertise is second to none in the industry. All Pentech targeted drug delivery nurses have received extensive training through our ANCC accredited intrathecal nurse fellowship program. In addition, there are extensive initial and ongoing trainings provided for all nurses during times of change or impact, such as with COVID-19 preparedness. All of Pentech's targeted drug delivery nurses providing IT pump refill monitoring services are registered nurses. Our nurses are available throughout the country to assist offices with patients with refills and adjustments. The actual distance traveled by each individual nurse will vary. Some nurses may travel to patients up to 3 hours away, while some in more heavily populated areas travel shorter distances. In some states, the government imposes distance limits for care relative to a Pentech Health office. Nurses hold a professional license in the state where they practice. Contact your regional account manager for specific capabilities. Pentech Health has over 170 registered nurses across the country who provide intrathecal pump refill and monitoring services to over 6,000 patients in the country. For specific areas of coverage, please contact a regional account manager. Pentech nurses are not in Hawaii, Alaska, Montana, or Rhode Island. Patients are still managed by their providers, who will need to provide orders for refills and adjustments. Our nurses complete the refills or adjustments based on those orders. Pentech Health nurses and pharmacy staff strive to collaborate with the patient and the provider. Our staff is available 24/7, 365 days a year to patients and providers to answer any questions or concerns that you may have. Beyond the extensive IT pump refill and monitoring services our nurses provide to patients, they offer several additional capabilities to the patient and provider. Our nurses become a trusted care provider to the patients. Many patients look forward to the social interaction with their nurse during their visit. Most patients will contact their Pentech nurse with any questions about their pump. In most situations, the nurse can respond to their concern, alleviating the need to contact the provider or clinic. Not only does the Pentech RN follow up with the provider after the visit, they truly become the provider's and clinic's eyes and ears in the field. Pentech nurses can inform the providers of a patient's home environment, personal care needs, and changes in advance of office appointments. For patients experiencing challenges or disinterest in forthcoming appointments, the Pentech nurse can encourage provider messaging and provider direction. Pentech nurses are available to patients, providers, and clinics for several less common concerns. These include post-MRI checks, assisting with appointment visits when available, assisting with prescription weaning processes, and unexpected pump adjustments. Pentech nurses are familiar with all pump manufacturers. They are capable of managing a patient through a Prometra MRI.